Okay, so if you've read and understood considering that history taking station, please begin.
Hello,
No.
I'm Dr. Bashir, one of the surgical doctor here. I'm going to ask you some questions regarding your condition and give you some problems to solve, just to assess your memory and try to answer as much as you can. Okay?
Okay, no.
Okay. Do you know where you are right now?
Yes, we are in shop market.
Okay. What's my job?
You are next.
Okay. And what do you know the current Queen of United Kingdom?
I don't know.
Okay. I'm going to give you an address. I want you to memorize it. Okay. 24 West Street.
Okay, 24 West.
Yes, I want you to remember it. I'm going to ask you at the end. So, what is the time of the day roughly?
Is it 9 morning? At 9 morning?
And what is this year?
I don't know.
Okay. And when did the Second World War ended?
I don't know.
Okay. And what is your date of birth?
19.
And what is your age?
70. I am 7.
Okay, could you please count from me backward from 20 to 1?
20. 19. 15.
Yeah. Okay. Okay. Would you please can you say tell me that address I told you to remember?
I couldn't remember the
Okay,
address.
no problem. I'm going to ask you additional questions. Okay, and what is this year?
2020.
And what is this the month?
Or January.
What is the season?
We are in summer.
And what is the day of the week?
Saturday.
And what is the time of the day? Date of the day, roughly?
Days, I think we are in January, 1st of January.
Okay. Now, what is the country we are in?
We are in Egypt.
And what is the state?
In Cairo.
What is the city?
In Cairo.
Okay. And what is the address of the building or the name of the building we are on?
I think we are in shop market.
And what is the floor we are on?
We are in the first floor.
Okay. Now, could you please repeat after me? I'm going to name us 3 objects. I want you to repeat after me. Pen, car, and pencil.
Pen, car, and pencil.
Okay, I would like you to remember it. I'm going to ask you a few minutes later. What is the? Could you please? I'm going to give you a word. I want you to spell it forward and backward for me. The word is world. Could you please spell it forward for me?
World, like this.
Spell it. Yeah.
W.
Yeah.
ORLD.
And backward, please.
DOW.
Okay. Now, could you remember that 3 objects I asked you to remember it?
I think you said pen.
Yes.
And paper. I couldn't remember the.
Okay, no problem. Now, would you please? I'm going. Are you right-handed or left-handed?
Right hand.
Could you please take this paper by your left hand and try to fold it once and put it down on the floor?
Okay, like this.
Yes, very good.
Okay.
Now, would you please, what is this object in my hand?
Paper.
And what is this?
Paper.
Perfect. Now, would you please tell me that, repeat after me, and ifs, ands, and buts, or buts.
Ifs and buts.
Okay. Now, would you please read the sentence in this paper and do what is said?
Okay. I read it.
Okay. Now, open your eyes. Would you please write sentence for me in this paper?
Okay. I wrote.
Okay. Thank you. Now, would you please copy that shape for me?
Okay, can you please summarize your history now?
Okay, I took history from this gentleman. He's I'm done the abbreviated mental scoring system.
Yes,
It was the 2/10,
yes,
and also I did the monumental state examination.
yes,
Was the 10
yes.
over 30.
So what is
So
your provisional
yes,
diagnosis?
so my main difference diagnosis patient is confused,
Yes,
mostly due to dementia
okay,
or delirium.
yes, and she has a short memory loss. All
Yes,
right.
and short memory
Do
loss.
you think patient is fit for the operation that she
No,
scheduled for?
no, because the patient
Okay.
cannot retain information and
Yes.
cannot take a informed decision about
Yes.
his condition.
So operation should not go ahead, right?
Yes, yes,
So what is the management that you can suggest for this patient?
yes. First, I will do full clinical examination to assess
Yes.
the patient condition and also underlying cause.
Yes.
Then I will go for investigation,
Yes.
full investigation, full blood count, urea electrolyte, liver function test, thyroid function test, and serum electrolytes
Yes.
like calcium and serum glucose. And
Yes.
also I will do bleeding profile, CT brain, and chest X-ray to rule out any infections.
Yes.
And then I will do urine analysis
Yes. And
and
your yes.
blood culture.
Yes. After investigations, you will come in contact
Yes,
with the patients.
yes. After that, I will contact with the
Network, yes, of the patient, like family, friends, and GP to
yes,
find about the patient's social
yes.
situations and carry out the systemic examination. All right.
Okay.
Either take care or give appropriate advice. Good. Thank you.
Okay. Thank you, ma'am.
I have one question, just regarding the score, the
Yes.
abbreviation mental test score and MRCS score.
Yes.
Is it mandatory to calculate this score in the exam?
Yes. 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 Otherwise, how would you establish that patient is having memory loss?
We cannot say it is below 20. Like monumental score, it is below 20, so the patient is have dementia.
Yes, once you're asking, you should have an estimated idea that how much it is. Only then you can establish the diagnosis. Otherwise, you can't just say it, right?
So we should take a paper during taking the
Yes,
exam.
or keep the record in your mind. Otherwise,
Okay.
you cannot establish the diagnosis. Right.
Okay.
Good. Thank you.